You know, of course, it's always nice when you can conveniently schedule an appointment to go to the doctor, but we all know that the truth of life is that sometimes injuries, especially when you're raising your kids, seem to flare up at the most inopportune time. So thank goodness Dr. Jason Robertson is right there ready to help you at the walk-in clinic with Center for Sports Medicine. Good to see you this morning.
Good morning.
I jokingly laughed with you and said, boy, I could have used you about 15 years ago, because any parent out there watching knows that inevitably the minute you get home from work at the end of the day or something like that, that's when your kids have some kind of an accident and you don't always have time to wait.
That's right. And we're here. Accidents are always unpredictable. And so that's why we have the walk-in clinic, just to allow patients to come in when injuries occur so they don't have to wait.
I'm not trying to imply that you are the same thing as an emergency room. Of course you have to go home and see your family as well. But what you do is you help people with non-surgical fixes to their problems, right?
That's right. So I'm here and available in the clinic, 5 days a week, and just here when patients need help. And we're here for urgent needs, certainly not things that require emergency care. If something is deformed or bleeding, certainly you need to go to the emergency room, but we're here for sprains and strains and acute arthritic flares and perhaps fractures that need evaluation and need quick care.
The truth is those can happen to anybody. I mentioned kids, but any of us can have a need to come in and get help from you. But you're going to be seeing a lot of people coming in now, I'm guessing, with basketball season starting up.
That's right. So of course you're right, all ages have injuries. Right now we'll see more falls from adults with the acorns falling off the oak trees, and with nighttime coming a little more quicker and leaves falling down from the trees. People might fall, but also this is the time for sports injuries from kids playing basketball and increasing their activities with fall sports coming up.
Talk to me too about the comprehensiveness though of what you offer, because if someone should come in and maybe their injury is great enough that you need to send them to another orthopedist in the practice, you're right there under the same roof, right?
That's right. That's right. So we have over 20 physicians of all orthopedic specialties. So if there's an injury to someone who needs surgery of the hand or elbow, we have hand and elbow specialists. We have shoulder and knee specialists, spine specialists, joint surgeons, foot and ankle specialists. So we have kind of the whole gamut of orthopedics, and we all work collaboratively together to take care of our patients.
You mentioned earlier that you'll see people with sprains. I have heard it said before that having a sprained ankle can sometimes be more difficult to heal than a break.
Yeah, sometimes it's a little bit more unpredictable with soft tissue injuries. There's still things that we can do to help get athletes and get people back to their sport, back to their activity much more quickly. With soft tissues, you can start therapy and mobilization a little bit more quickly than you can with fractures. And fractures sometimes are a little more predictable than those sprains or strains.
Is it important, if you do have a sprain, to do some kind of strengthening exercise once it's safe to do that?
That's right. So you do want to protect the joint after an injury, just to allow your body to have a little bit of a break and rest, and then your normal kind of God-given natural responses take over and begin that healing process. Early mobilization is key for some of those injuries, and so therapy sometimes is used to help get patients back more quickly. Certainly icing and anti-inflammatories can sometimes play a key role as well.
So let me ask you this. I know that we've all adjusted to the restrictions with COVID. Are you, for what you do in the practice, can people utilize you with telemedicine, or is it important to have that walk-in face-to-face?
No, we all have telemedicine access, and so certainly that's available. If somebody has questions and they've taken a fall and they're wondering if they need to come in and get x-rays or if they need to come in at all, they can schedule a telemedicine appointment through our iOrtho evaluation with any of our providers. And so that certainly is still something that we provide to all of our patients.
Well, I'm talking to you on a rainy day, which also can add, pardon the pun, but insult to injury. So I'm sure your warning would be to be very careful and wear practical shoes today.
Absolutely. Be careful. Again, this is the time for adults to slip and fall. with the leaves down and acorns down and nuts down, and then with the weather changing too. So these next few days, definitely be careful.
Dr. Jason Robertson, Center for Sports Medicine, thank you so much for your time this morning.
Thank you, Julie.
You can learn much more about all the different doctors who are there to help you with whatever your orthopedic need may be by going to sportmed.com. The phone number for the Macaulay Avenue location there on your screen, 624-2696, but they do have locations scattered throughout the viewing area to make making an appointment as easy as possible. Thanks again, Dr. Robertson.
Take care.
You too. We're back after this.